I imagine there are several approaches to addressing post-marketing pharmacogenomic signals, ranging from regulatory mandate in response to safety concerns to industry-led post-marketing surveillance programs and expert groups also synthesizing the evidence and making recommendations to bodies like MHRA and NICE. In your view, which of these represents the most appropriate and sustainable model for implementation of PGX information in clinical practice?
Thanks. So I don't think anything that we do in terms of generating evidence should be exclusive. All of those particular potential stakeholders can generate the evidence in order to be able to have the relevant evidence base for pharmacogenomics implementation. Clearly, industry, when they are developing a new drug, will be able to assess whether a drug is subject to polymorphic metabolism, etc., very early on, and then they can take that into account in terms of development programs. So if you look at siponimod, which is for the use in multiple sclerosis, they were able to identify cytochrome P452C9 was important to its metabolism, so they were able to do the studies and the pharmacokinetic studies to show that it was important to be able to genotype before you went on siponimod for cytochrome P452C9 polymorphisms. So they were able to do that in the early development process. But if you look at what's out there in terms of implementation to clinical practice, most of the work has actually been done by academic investigators. And most of the drugs are generic, they're off patent, and industry will not really be interested in undertaking further work on those. And so those relevant stakeholders have been able to look at the evidence base, undertaken further studies, highlighted the sort of importance of variable metabolism, etc., in order for the implementation of pharmacogenomics and so on. So I think it depends, again, on the context and depends on whether the drug is early in development or post-marketing, as you mentioned. And then if it is post-marketing, it can be up to anybody to be able to develop the evidence base. But in most cases, it has been academic investigators to develop the evidence base.